Hey guys, it's me. I am here to talk about the medication Lamictal, kind of give my own review of it and share some of its side effects and if I think it is worth it or not. Okay, so let's start. Lamictal, also known as lamotrigine, is an anticonvulsant and mood stabilizer, so it's for people that have epilepsy and bipolar disorder. Yeah, and I just want to say that this is kind of like the up-and-coming medication for bipolar disorder. I'm not too sure about the epilepsy thing, but yeah, that's why I brought it up to my my doctor, because I heard great things about it, like overall, and I thought maybe it would be something I could try, because this doctor prescribed me something that I didn't quite agree with, just because one of the side effects was weight gain and diabetes, and I am just one of those people that does not want to gain any weight and definitely does not want to get diabetes. So that's just like a personal preference thing. So, and Lamictal isn't supposed to make you gain weight, so it's one of the few mood stabilizer medications that won't make you gain weight. So yeah, and obviously that's not the whole reason why I went with Lamictal, but like I said, it was just, it had a general positive overview of it. So yeah, okay, so anyways, I am going to list some major side effects and some less common side effects and some rare side effects, and give you guys some warning stuff too. Yeah, okay, so if you guys have not heard of Stevens-Johnson syndrome, I am not gonna talk about that in this video just because it's really horrible and I don't want to get bad images in my head. So yeah, if you guys don't know what that is, just look it up. But people taking Lamictal, especially children and people that are taking valproic acid medications like Depakine or Divalproex, and if you're on too high of a dosage of Lamictal, you guys can develop, you have a higher chance of developing Stevens-Johnson syndrome. And I'm not too sure why that happens. I haven't really researched that, but if you guys have any idea why people that are on Lamictal have a higher chance of developing Stevens-Johnson syndrome, please feel free to comment and let me know. Yeah, and Lamictal can be prescribed for children at a very young age. Probably has a lot to do with epilepsy, I'm not so sure, but yeah, so okay, I'm going to talk about the most common side effects that come along with Lamictal. Thoughts of suicide or moods get worse. So if you are bipolar and you start this medication and it only seems to be making your depression worse or sending you into a bad mania, it obviously is not the right medication for you because it's not helping at all. Headaches, dizziness, blurred vision, double vision, any change in vision whatsoever, tremors, loss of coordination. Tremors are just like when you're very shaky, uncontrollable shakiness. Dry mouth, nausea, vomiting, stomach pain, diarrhea, fever, sore throat, runny nose, drowsiness, back pain, insomnia, dysmenorrhea, which are painful periods. Lots of women actually have this. I am actually one of those women. I actually had to have an exploratory laparoscopic surgery to see if I had endometriosis, but it turned out I had giant cysts on my ovaries, which they removed. Not my ovaries, but the cysts. I don't even know why I'm telling you guys this. Anyways, rhinitis and clumsiness. So, gosh, my hair is just like falling in my face. Sorry. Yeah, so like, I think rhinitis is when you have like a really stuffy nose all the time or something. And clumsiness, obviously, you know what clumsiness is. Okay, less common side effects are as follows: anxiety, confusion, depression, irritability, chest pain, increase in seizures, uncontrollable eye movements, infection. So, the uncontrollable eye movements thing has to do a lot with like seizures and stuff. Though, even if you're not epileptic, you can experience those uncontrollable eye movements. Okay, and now the list of rare side effects: blistering, peeling, loosening of skin. So that kind of has a lot to do with Stevens-Johnson syndrome. Those are like the early stages of Stevens-Johnson syndrome. Also, if like you're getting hives all over your body and like discoloration of skin and like patches or whatever, definitely need to go to the emergency room if you develop any type of skin change whatsoever when you're on this medication. Okay, anyways, chills, fever, flu-like symptoms, itching, memory loss, small red or purple spots, sores, ulcers, swelling, and trouble breathing. So, yeah, those are all, you guys all know what that stuff is. Okay. Alright, and symptoms of an overdose. I thought this would be important to share with you guys as well, just because a lot of people don't realize that when you picture someone who has overdosed, you picture them like foaming at the mouth and on the floor and eyes rolling back in the head and they're like totally dying and whatever, but that's not always the case. You can overdose and be totally alive and awake and alert, but you are not feeling okay, and so yeah, you can overdose and be alive. Yeah, so symptoms of overdose: severe clumsiness or unsteadiness, severe uncontrolled eye movements, severe dizziness, severe drowsiness, severe headaches, increased heart rate, and slurred speech. So, like, this is all like severe stuff. So if it's like really bad, and you're just not feeling okay at all on this medication, maybe you're on a higher dose or something, so you should definitely call your doctor and let her know, or him know, that you might want to lower your dosage. Yeah, because even if you're just taking like one pill a day, but the dose is too high, you can still overdose unintentionally. So yeah, talk to your doctor about how you're feeling at all times, just to let her know. Okay, and just some warning stuff. Some things to keep in mind while using this medication. If you are using birth control while taking this medication, sorry, that's really bothering me. The birth control can make the Lamictal less effective. I am also not entirely sure why that happens, so like I said before, if you guys have the answer for that, if you have your own experience with it, like you're on birth control and you're on Lamictal and you do find it true that it has, Lamictal has less of an effect on you, please share your stories or comments or anything like that. I'd love to know. Yeah, okay, so, and also this goes with nursing, so breastfeeding, and when you're pregnant, because it can pass through to the baby through your breast milk, and when you're pregnant, you are not supposed to be on this medication at all because the risks of birth defects are very high. So doctors do not recommend you being on Lamictal while you are pregnant. And I'm sure there are other medications out there that you can use while you are pregnant, but just the risk for birth defects are much higher when you're on medication while you're pregnant. And me personally, if I were to get pregnant, I would just not be on medication just because I would rather I don't want to risk something like that. So yeah, and obviously you are not supposed to take this with alcohol. You're not supposed to take this medication with alcohol. I have had a few drinks while being on this medication, and during the time that I'm having those drinks, I don't feel too much of a difference or anything like that. But the next day, it'll definitely put a damper on my moods, and it's not because I'm hungover, because I don't get hungover, but I just think it has an effect with medication. So if you're gonna drink, keep that in mind. I do not encourage you to drink while on medication, but I know people will do it anyways, so I'm just saying to be careful, because it's just not a good idea. Oh yeah, and I wanted to share some of my own side effects that I have experienced during this time. Some of them I worry about, which I will definitely bring up with my doctor, and others I am fairly okay with as long as the medication is doing its job. So, alright. Some side effects I am experiencing. Minor tremors, especially if I am late taking my medication or haven't had food before or after I've taken it. Clumsiness, insomnia, which I don't get insomnia too often, but when I do, it's hell. Like a couple of days ago, I could not for the life of me fall asleep, and I stayed up until 6 in the morning, and I only got maybe 2.5, 3 hours of sleep that day. And I recorded this video the next day, and I ended up deleting it because you could just tell that I was exhausted and I was very monotone, and I thought it would just be really super boring for you guys to watch. So yeah, insomnia, uncontrollable eye movements. I used to experience this when I was in middle school. I don't know why, but if I was like reading or writing or something, it would just like kind of do this like weird shaky thing. and there wasn't anything I could do about it. Like it says, uncontrollable eye movements, and that hasn't happened to me until I started taking this medication, and every once in a while it will happen. Like the other day I was doing the dishes and it happened, and it was no big deal, but it still worries me, of course. So yeah. Change in eyesight. So I used to have really perfect eyesight. I could see everything clearly. Sorry, I'm like rocking back and forth. I could see everything really clearly. Reading was super easy. But now it's more, it's kind of like blurry. I wouldn't say like so blurry to the point where like I can't, you know, see everything, but it's definitely changed, and I don't like it because I need my eyesight. So yeah, and then I'm not kidding you guys, this medication has made me completely dyslexic, which really sucks because I'm a writer and I love to read, and now it's really difficult for me to write anything because I forget how to spell words. I add the same word 3 times without even realizing it. I put words in that shouldn't be there. I see words when I'm reading that shouldn't be there. And I have to go back and reread it, and because like it, you know, the sentence I read doesn't make sense at all. And yeah, it's actually really scary because I'm not used to that. I'm a really good like speller. I know how to spell like words really well, and so now not being able to remember how to spell simple things really bothers me. So, and I don't know if like a lot of people experience that. I'd love to know if other people experience that, because it would make me feel a lot better about it. Like, oh yeah, this happened to me too, but don't worry, like it gets better, or you know, we just gotta work with it, blah blah blah. So yeah, if any of you guys have experienced this on Lamictal or really any other medication, let me know in the comments below. Foggy memory. Really horrible memory. I can't remember shit anymore. I'm not even gonna go into that because it makes me really upset. And I also space out a lot, which I am like a spacey girl. I daydream a lot and whatever, but this time like I catch myself just spacing out and not even thinking about anything at all. Like I'm just staring and there's like nothing. There's like blank in my head. Like I don't know. I'm not used to that. And then I also have like this purple spot on my thumb. Here, I can probably show you guys. It's not really purple, but I mean in person it's more purple, but that's that. I don't know where and why it came from. It doesn't itch, it doesn't hurt, it's not like raised off of my skin, it's not peeling, it's just there, and I don't know what it is. So yeah. And has this helped me? I think that it's definitely helped me to kind of balance things out and stabilize me. Like I definitely have my days, but it's not, I'm not drowning and I'm not way up high. So it's good at keeping me kind of level, which I really needed. And do I think it is worth it? I think so far it is. If the dyslexia and eye movement, eyesight stuff gets worse, I might have to consider another medication, just because it really bothers me a lot. And I really hope that doesn't happen, just because I don't want to go through the whole finding the right medication for me thing, because you know, you gotta try all kinds of different medications and go off them and find new ones and go off those, and it's definitely not something that I'm into. So yeah. And a couple of notes. I wanted to say that although all of the side effects and risks sound really spooky and dangerous and risky and whatever, but just keep in mind that it's pretty rare to get those really rare side effects and Stevens-Johnson syndrome. They do happen, but not very often. It's very, very rare. So, you know, and every medication has its risks. So, you gotta keep that in mind too. Like, yeah. So, and I also wanted to make sure to tell you guys that if you guys are thinking for a second that you don't need medication, or you want to get off your medication or find a new one, please talk to your doctor before doing anything at all. I have made the mistake before of just cold turkey, like quitting my medication, and that is never okay to do. It's not safe. So definitely talk to your doctor if you feel like you don't want to be on your medication anymore, due to whatever, I mean, your personal preferences or whatever. So always speak to your doctor. Let me see if there's anything else I wanted to mention. Oh yeah, oh wait, no, never mind, I already told you guys that. So I think that's it. I definitely suggest mentioning Lamictal or lamotrigine to your doctor if that's something you'd be interested in. I highly suggest researching it more and kind of feeling around with it, because I do think it is one of the best out there for bipolar disorder. I mean, so far, for me, I should say, I think that it's helped me tremendously. So yeah, definitely go and research it more and bring it up to your doctor if you think it might be something you'd like to try. Yeah, so that's it, and I think I'm gonna end the video here. I don't know, I definitely have a few more videos coming up. I'm not sure which one I'm gonna do next, but I will figure that out. And so you guys should definitely subscribe. You should like my Facebook page, because I make updates on my Facebook page, just to kind of let you guys know what's going on, what I'm doing next and stuff. So definitely check out my Facebook page, give it a like, give this video a thumbs up, comment, share, anything that you would like to do. And like I said, please subscribe. Yeah, so I hope you guys have a really good day and be safe with your medications. Research around if you're feeling like the medication you're on is not doing well with you, because sometimes that happens. So be safe, talk to your doctor, and stay healthy and stay happy, and I will see you guys next time.